since then, we've replicated study after study after study after study. And what we found is that psychedelics, when used properly and effectively, cause massive shifts to people.
We are joined in studio today by Dr. Anthony Townsend, a multifaceted psychologist practicing a range from neuropsychology to psychedelic-assisted therapy and everything else in between.
It's probably the most common phrase people will come in, they say, I have anxiety.
Right.
And I say, okay, cool, tell me more about it, right? Because one of the great misunderstandings people often hold is that anxiety is like a disease or something. Because that's kind of how doctors and psychologists speak about it. The great pleasure of my career is that the impact you have is very clear, very real, and quite palpable in people's lives. So there's nothing better than hearing someone say, I'm not depressed anymore, or I've overcome an addiction, or my relationship with my kids is so much better. That's an amazing thing to get to be part of. So that becomes the base. Our professionals are amongst the best on this planet. Like, we are very, very fortunate that we have unbelievably skilled professionals helping our population. We are a really high caliber of people.
Ladies and gents, we are joined in studio today by Dr. Anthony Townsend, a multifaceted psychologist practicing a range from neuropsychology to psychedelic-assisted therapy and everything else in between. His work combines scientific expertise along with how people think, feel, and behave. Today, we explore his career and we get to know him a little bit better. So, ladies and gents, get locked in. Come along on the ride with us here on EXC-i8. Let's do this. So, Anthony, thank you for making the time and effort to be here with us today. How are you, brother? It's been a long time.
It has been a long time, Terence. It's a great pleasure to be here with you guys. I'm very excited for today. Long time coming, man.
Yeah. I'm a little bit nervous. I don't know, you got me feeling a little bit insecure. I don't know if it's because of the thought of I'm sitting across a psychologist and he's going to be sitting there analyzing me. But also, being old boys and knowing each other. So all of those things, kind of come into play. So maybe, I'm going to use that opportunity to just I don't know if it's a simple question, but do things like that affect how people behave and, does it put them off their game?
It massively does. So you're not alone in this.
Right.
It's very funny. You'll see a bit of a paradoxical effect. It puts people at ease when they come to consult with me, knowing that I'm a psychologist.
Yeah.
But if you're not in the therapy room, it makes people very nervous, very awkward, and they behave very strangely. It's for this reason that I often, if people don't know what I do, I don't tell them.
You don't tell them, just so that they can be at ease and be their authentic selves, be comfortable around you, right?
Exactly. So then I get to really analyze them without them knowing, of course.
Cool. So, and why psychology?
It's a great question. And the answer that I've come to understand through years of my own therapy, right, is that when I got out of school, when you get certain marks, everyone expects you to do certain professions.
Yeah.
And so the two things I got on for were law and medicine.
Okay.
And with respect to lawyers, I felt like one of those professions is about helping people and one of them is about hurting people.
Right.
So I went with medicine. And as I often explain to people, when I look back on it, I think I studied medicine to impress my father.
Okay.
But I ultimately switched to psychology because deep down I wanted to save my mother.
Oh.
And I think that was a big part of what made that such an appealing field to me. And this was something I only realized years later when I was of great help to my mom in a great time of need for her.
Yeah.
And it kind of unlocked something for me, and I realized this is actually what I was trying to do all along.
Okay.
And once I'd accomplished that mission without realizing it, I got to do this from a totally different perspective, where it's almost like that was done. Let's expand the good.
Right. If I may, right, you mentioned you wanted to do it to help your mom. If you're comfortable with explaining and opening up about that, what was the situation?
So my mom, because of her own experiences and traumas, had struggles with certain substances, certain experiences, and as a result got locked into some really bad patterns in her own life. And it's something she and I have worked through for a great deal of time.
Wow.
And there was an occasion where she was really struggling at a point, and it was actually during my studies. And it was at that time, for the first time in my life, I actually knew what to say, what to do, and how to help.
Yeah.
And it was tremendously rewarding to be able to be there for my mom. And to her credit, she's grown in leaps and strides since then. She's recovered fully. She's been an incredible woman, and it's made our relationship so much better. It's grown our family so much more. And that was the moment when I realized, actually, I think deep down that's a little bit of why I wanted to do this.
Wow, that is incredible. And of course, now you get to help so many different people, right? In the same way. That is beautiful, Anthony. So, earlier I was asking, how do you find the time to juggle everything, right? I mean, you practice, clinical therapy, neuropsychology. I mentioned in the intro about, the psychedelic-assisted therapy, and even, flight assessments. Is that correct?
That's right.
How do all of these, interact with each other, and how so?
So they very much do. And I think for me, I have such a wide range of interests. I mean, they're all linked by psychology.
Okay.
Because ultimately what I found the difference between medicine and psychology for me personally is that medicine's intriguing and meaningful, but it could often be very mechanical, very static in its approach, whereas psychology is more dynamic. It tries to blend both art and science, which is much more appealing to me.
Right.
And so clinical therapy is definitely my base, because the thing that I really do get most excited about and find most meaningful is helping people live more fulfilling lives. The great pleasure of my career is that the impact you have is very clear, very real, and quite palpable in people's lives. So there's nothing better than hearing someone say, I'm not depressed anymore, or I've overcome an addiction, or my relationship with my kids is so much better. That's an amazing thing to get to be part of. So that becomes the base, really trying to help heal and make lives better.
Yeah.
Where the other forms of psychology really blend in with that is that clinical therapy becomes my base and my vocation. It's where I spent at least 50% of my professional time. Neuropsychology, which is something I also specialize in, is very much about understanding brain-behavior relationships. So it's understanding the biology that underpins things. I personally think it's incredibly important for people because while we have different cultures, different environments, different personalities, we all have nervous systems that work the same way, man. So if you understand the brain in someone's head, you can really understand a lot about the way the mind works, and it helps create a universal understanding that underpins a lot of the work that we do. So I usually find that while neuropsychology has its own place and its own interventions, it feeds therapy very well to understand the organic basis of some of our experiences that aren't just so theoretical in nature. With things like aviation medicine, that's kind of a remarkable field and a really intriguing one. A big part of what attracted me to that was that my dad was a pilot when I was a kid. So that already kind of, tickled my fancy to kind of be involved in that. But what you'll find when you're assessing pilots is that you're having to assess people who do a really remarkable job. And so you're assessing quite remarkable people in rather unusual and extreme conditions. So you won't just learn what life is like in an everyday matter. You'll learn what life is like under remarkable pressure and in unique circumstances, which gives you a whole range of humanity that you don't always get to experience. And finally, the one that I often do is forensic psychology. And where forensic psychology fits in is that will sharpen you intellectually. There you are trying to do good, but objectivity, science, and precision becomes the order of the day. And so therapy will give you a heart, neuropsychology will give you a brain, and forensics will give you objectivity and sharpness so that you can play off each other to make you a well-rounded, effective therapist.
Very interesting. I had a different thought of forensic psychology. I don't know, blame it on TV and pop culture, but I was like linking that to CSI or something along those lines. Like, that would be interesting.
You're not actually wrong, in fairness. That is a branch of it. So that would be what we call criminal forensics. So forensic just means applying psychology to legal matters. So that can be child custody, divorce mediation, wills and testaments, but it can also be the criminal branches, like you said, in criminal profiling. That is a real thing. It does exist in South Africa. The people who have led that field are some of the best psychologists you'll find around. And there's a touch of that in the work that I do, but it's not all CSI every day.
So there's a couple of things in that I want to just loop around back on from what you were explaining about the different fields of practice that you delve in. When it comes to neuropsychology, right? You mentioned that we all sort of the same in certain aspects, right? So does that mean that there are I guess, common factors that you look for when doing a neuropsychological assessment, or are there these common factors that seem to creep into a neuropsychological assessment?
There definitely are. So very often when you're doing a neuropsychological assessment, somebody has actually come in because they believe there might be something wrong with the way their brain operates.
Okay.
Now, a lot of people get confused. They go, okay, well, why don't they see a neurologist? Neurologists are remarkably effective specialists, but they focus more on the basic elements. They want to see that your spinal cord is working, that your basic behavioral aspects work fine. Neuropsychologists look at the higher order stuff: decision-making, reasoning, emotion processing, memory functioning, those sorts of things.
Sure.
So usually someone comes in because they think something's not working the way they would like, and they'd like to know if that's the case, how bad it is, and what you can do to resolve that. In a broader psychological assessment, that could be anything. That could be someone's coming in saying, hey, I'm struggling with this, or I want to understand this better in my life. But in both cases, there are commonalities amongst people. Right. So, for instance, one of the things that you'll often see people experience is they'll say things like, I'm coming in because I have anxiety.
Okay.
Now, I often smile when people use that phrase, and you'll understand better when I say what that really means.
Before you carry on, is that like probably the most common one?
It probably is. Okay. It probably is. And it's probably the most common phrase people will come in. They say, I have anxiety.
Right.
And I say, okay, cool. Tell me more about it, right? Because one of the great misunderstandings people often hold is that anxiety is like a disease or something. Because that's kind of how doctors and psychologists speak about it.
Yeah.
So the problem we face is that it's actually not a sign that your nervous system or your brain is doing something wrong if you're anxious. It's actually very often a sign that it's doing something right. So if I had to define anxiety, anxiety is an emotional reaction to an uncertain, uncontrollable future.
Right.
So whenever you're sitting in a situation where you don't know how you're going to deal with what's to come, when you're not sure about it, you're going to get anxious. You're going to get nervous.
Yes.
That's why we get anxious when something's new.
Yes.
That's why we get anxious when there's something changing.
Yes.
And there's a lovely poet named Alfred North Whitehead, and he has a great way of explaining anxiety. He says, we have anxiety so that our thoughts will die instead of us. And the idea there is that when you're left in an uncertain situation, your brain goes to different scenarios.
Yeah.
What about this? What about this? What about this? It's busy planning strategies to contend with all the difficult things that happen to you and could happen to you. Now, if you're feeling that,
that's true.
That could actually be pretty useful to do.
Yeah.
You know, I often say to people when they're very anxious, I'm like, have you ever imagined what your life would be like without anxiety? And their first answer is usually, it would be wonderful. And I'm like, I know it sounds that way, but think about it. If I take away your ability to worry about the future, how well do you think things are going to go?
Anthony, wait, bro. Come on. My wife is going to be watching this. She's like, yeah, you see, it's good that I'm like this. You always tell me not to worry.
So there's going to be a caveat. So we might be able to recover you in the arguments against your wife.
Cool.
So if you couldn't worry, you wouldn't save money, you wouldn't take out insurance, you wouldn't have medical aid, you wouldn't even have manners because you'd never worry about offending anybody. However, people think that an anxiety disorder, as we might call it, is about the presence of anxiety.
Okay.
It's not. The presence of anxiety is not your problem. The absence of coping is.
Yeah.
So you're supposed to worry, but the question becomes, how do you deal with your worry? Do you sit and just worry and panic and freak out? Do you sit and vent and take it out on other people? Because there are better and worse ways of dealing with this.
Sure.
So maybe we'll say to your wife, no, it's not that you don't have to worry, but what if you learned better ways of putting that worry to work so that it doesn't cause problems in your life? Yeah. It might make things better.
See, I like where this is going now. We're back on track.
That's good to hear. So the commonalities you'll often find for people is we all hurt, we all suffer, we all get distressed.
Right.
That's usually not the problem. The question is, how do we deal with it?
Okay.
Because if you give people a framework, a science-based, effective means by which to deal with the problems in their life, things get a lot better.
Yeah.
We're not defined by the problems that we experience. We're defined by the solutions and remedies we can garner in our lives to contend with the stresses in our lives. And that's so much about what psychology is about. It's not necessarily about ruminating about the problem. It's learning innovative, robust ways of being able to deal with flexibly and effectively the problems that we face.
Wow. So in scenarios like that, right, where you're dealing with a patient that's, I'm super anxious, and you start to, unpack that, do you then help them put systems in place to navigate around certain things. And now they, like you say, you know, once you can see there's a framework, and I've got a plan, does that usually help? Do they come back to you and say, wow, Dr. Anthony, you know, this is incredible. It's actually working. Yes, I can feel the, you know, the thoughts or the concerns there. But when I look at the plan that we put in place, I'm put at ease.
That's exactly how it works.
Okay.
And that's usually when therapy is done right. My job is to help them understand this better, help co-construct a plan for their unique circumstances that they can contend with whatever comes.
Yeah.
And you'll notice that when people feel that way, it's like, I know what the stressor is, but I know how to deal with it. I know how I'm going to manage it. I know how to limit the suffering. I know how to get towards what I value. They feel bulletproof. They feel stronger. They've developed resilience. And they usually don't need so much more therapy after that.
That is incredible, right? And it's like you say, when you do the job right, then that's what happens, right? So the next thing I wanted to ask you is regarding the flight assessments, right? I think this is quite interesting. What would, you know, how would that work, right? And what would determine if a pilot is fit for flying? Or rather, maybe the more interesting take on it would be, what would determine whether a pilot is not fit for flying?
It's an amazingly important question. And I mean, a lot of people ask it and they find it interesting because there's something unique about pilots. So in aviation medicine, you can't assess someone as a normal person. In order to do that job, you kind of can't be a normal person. You have to be able to do things and tolerate things that most people can't handle. So the requirement for a pilot to be fit to fly is that they would pose, as is put in the literature, a less than 1% risk of something going wrong. Now, I don't know about you, but I don't often get a guarantee of 99.1% this is going to be fine. That's the criterion pilots have to meet. They have to be that good at what they're doing. And they can get affected in one of two ways. Number one is they could have a cognitive faculty that's not sharp enough. So if you're a pilot, you can't have average processing speed. You've got to have above average to superior processing speed. You can't have an okay memory. You've got to have an amazing memory. And so the assessments that we do similar assessments for them, but the criteria are much more stringent for them to follow. So they have to be super performers in a lot of these areas. The other thing that you look at for a pilot is how emotionally stable are you? Because not only do you have to do all of these complex tasks, because I mean, if you ever watch someone flying a plane, it's unbelievably complicated to do that. Not only they have to be able to do that, but they have to be able to do that under incredibly stressful conditions. You know, if something's going to happen, they have to know how to remedy the situation in a really complex way, with red lights flashing, dings going on, 500 people's lives in their hands. And so very often when we do a test, we're not only going to make you do something really complex, but we're going to put you under tremendous pressure while doing so. So one of the tests that a lot of people see that I think is a good way of explaining it is very often if you do a neuropsychological assessment with someone, you're going to test their ability for complex attention and memory. So what I'll do is I'm going to say a whole bunch of numbers and letters to you. So I'll go like 1G, 2H, 7B, blah, blah, blah. And I'll go for about like 10 of those, right? And I'll say, now I want you to repeat them back to me, first in numerical order and then backwards in alphabetical order. So I want you to separate them out. But while you're doing that, I want you to keep walking up and down this platform that I've got for you. So I'm putting you under pressure. I'm making your heart rate go up. And you'll be amazed how effective pilots are actually at doing this.
Really?
They can do extraordinary things. So those two things are what's going to make you fit as a pilot. Amazing cognitive processing, as well as an incredible ability to tolerate stress and maintain emotional stability. And when you bring those two things together, you've got someone who can do this job. If there's a problem in one of these areas, it's not really necessary for you.
Wow. No, I think I failed already after the first number and letter combination.
Me too.
So on the topic of, you know, the flight assessments, I'm curious now, and the movie with Denzel Washington popped into my head where, you know, he plays the role of the alcoholic pilot. I can't remember the name of the movie. Is it Flight?
I can't either, but I know which one you're talking about.
Yeah. Maybe you guys can help us out in the comments. You know, if you remember the name of the movie, drop a comment and help us out. I think it's called Flight. Maybe. I don't know. But if you watched the movie?
I have.
Do you think that, you know, given what you've said to me now, could that situation have been prevented? I don't think, you know, what happened on the plane was his fault, right? He handled it well. He landed the plane safely and all of that. But in a normal scenario, he should not have been declared fit to fly.
That would usually be the case, yeah.
So how does somebody then, sort of pass that process? Or do you think it just wasn't done? Was there neglect from, I don't know, the flight assessment side?
So, I mean, the interesting part about it is that pilots are amongst the most assessed people on planet Earth. They do regular checkups, medicals, psych exams. They're constantly getting evaluated by someone called their designated aeromedical examiner.
All right.
So they're constantly being assessed. But of course, there's always a possibility of something slipping through the cracks.
Sure.
And that's why all of your civil aviation boards around the world make sure that there's these regular checks. What is remarkable about pilots, and why that's kind of the exception, not the rule, is that pilots more often than not are well aware of the responsibility they hold. And so my experience has been that very often, if there's something compromising for them, they're the first to put up their actual hand and let you know. So as much as the movie, as you say, like gives a more dramatic portrayal of it, we've got to remember that 99.1% of the time, that stuff's getting caught.
Okay, cool. With, forensic cases, right? What are some of the commonalities that you encounter with dealing like a child custody battle? Are there commonalities?
Unfortunately, more often than not, there are.
Okay.
It's a really difficult and sad situation when there's a conflict over the care of a child between two parents. And sadly, in many cases of high conflict divorce, you'll find that when they're together, the parents are absolutely fine with each other's ability to raise a child. But the second they're apart, that all of a sudden changes. And there becomes this really big feud over who's okay and who's not okay. And this sort of adversarial bond develops between the two of them where they're stuck together, but they're constantly fighting each other.
Yeah.
More often than not, that leads to a really problematic process. It's called by psychologists alienation.
All right.
So very often what happens is one or even both parents will be so angry and hurt by the other parent that they'll almost engage on sort of a campaign of hatred against the other.
Okay.
And they'll tell the child all the negative things about that parent, true or untrue, right?
Yeah.
And it really starts to poison a child's relationship with the other parent. And that can be a really, really terrible thing because, of course, it places a child in a position that they should never, ever have to be in. It creates a greater conflict in the family systems. And more importantly, it forces a child into a position where they're no longer letting their own experiences of their parent dictate their perceptions, but rather the other parent's narrative.
Wow.
And it can be a really devastating, horrible thing that happens in families. So a big part of forensic psychology when it's applied to things like child custody cases is to really try and limit those things, create interventions and ballasts against them so that the child is afforded meaningful and good relationships with both of their parents, with all things being equal.
Absolutely. Look, without me knowing the stats or having done any research, but that to me sounds like it's probably the number one thing, right? That every case like that would have in common.
Exactly.
Okay. So then where would your intervention come into play? Would that be like a court order or, in that process? Or is it outside of the court, when the family's trying to move forward? Is it help that they would have to come and seek privately? Like where would you fit in that process?
There's a lot of stages where someone could fit in. Okay. So if it's before it goes to court, they could come see a psychologist as a mediator where they're trying to do this amicably. But more often than not, where my role comes in is either both parties will agree to appoint me to do an assessment for them for the court, or the court will order it, or their attorneys will ask me to do that.
Okay.
So the way that I work, either the court orders it or both people agree. I don't represent one parent or the other.
Sure.
I'm a neutral person who's doing an assessment to protect the child's best interests. So I'll usually enter in when there's a legal dispute.
Okay.
So often the court will ask me, hey, can you do a big assessment, a very long assessment of all of this and write a very long report with lots of recommendations on how we should move forward so that we can use that to structure our plan. There are some psychologists who, after the fact, will then do the actual therapies, etc.
Right.
I don't often do those therapies. I more often do the assessments to be able to create the plan for everybody to use. Sure.
Thank you for explaining that into more detail because my next question would have been like, where would your work stop? Or is there, aftercare, once we are done with the assessment and the court and everything? Okay. So I'm curious about the psychedelic-assisted therapy, right? And when I think of that, look, I think of the different psychedelics people use, for, shall we say, leisure and recreational purposes. Like shrooms, How does this work in psychology, right? You started a company based on this. You could maybe tell us a little bit about that, like where it started, because you told me there was a change in the name, or maybe does that also affect the change in the structure? So maybe unpack everything. Like, why did you decide to get into psychedelic assisted therapy? What are the benefits? Who benefits from it? Is it more than just a trip on shrooms?
I definitely hope it's more than a trip on shrooms. Otherwise, we're not doing our jobs, man. Absolutely. So it's a really, really exciting thing globally. You know, I'm sure a lot of people are familiar with the news around this, and there's been a lot of hype and buzz. Some of it is very well deserved, although it should always be tempered by reasonable expectation. So I think it's fairly common knowledge for a lot of people that things like mushrooms, ayahuasca, your naturally occurring psychedelics, have actually been used by humankind for thousands of years. You know, in shamanic traditions and ancient traditions, they were used previously as what you call entheogens. They're used as molecules for spiritual growth.
Yeah.
So we know that there's been a long history for them. Only in about the 1950s did psychologists and psychiatrists start stumbling upon these molecules as potential therapeutic agents to create change for people.
Yeah.
And in some of the early studies done by people like Dr. Humphrey Osmond in 1956, they would find that when they gave people a single dose of a psychedelic like LSD, they would often find that people got rapidly a lot better very quickly and stayed better. So in these really tiny studies, they'd find that if they gave 6 people who struggled with alcohol use disorder this one single dose of LSD, like 5 out of 6 of them just wouldn't drink ever again.
Okay.
And that was astounding.
5 out of 6.
We never really see results like that in psychology and psychiatry. So it was one of those that almost sounded too good to be true.
Right.
But just as quickly as it got started, it closed down. In 1971, all of the psychedelics were classed as dangerous chemicals under Richard Nixon. And of course, that's where we saw the war on drugs start. And so all of the research efforts halted.
Okay.
Only in around 2006, thanks to the efforts of pioneering researchers like Roland Griffiths, did we start to see a resurgence of interest in these molecules. Now, Roland Griffiths was a really special guy. He passed away not too long ago, and may he rest in peace, because he was a really special guy in the sense that he was a very, very conservative psychiatrist. He was like the most by-the-book guy you could imagine, and I think that's the only reason they let him study these molecules. He was actually interested in addiction. And what he thought was really interesting was he went on meditation retreats, found meditation really helpful, and people had mentioned to him, no, psychedelics are a lot like meditation, which is true to a degree, so you can try those to help people. So he did a study where he took people who were dying of terminal cancer, who were terrified of their deaths, and he gave some of them a placebo agent or an alternative agent, and he gave some of them psilocybin. And the people who took psilocybin would rank it as one of the top 5 most meaningful experiences that they've ever had.
Wow.
And very often they would no longer be afraid of dying.
Wow.
Now he, having never experienced psilocybin, was absolutely shocked at like how profound these effects were. And so since then we've replicated study after study after study after study. And what we've found is that psychedelics, when used properly and effectively, cause massive shifts to people. And there are good reasons for this. So for those unfamiliar with what we mean when we say psychedelic, it was actually a term coined by Humphrey Osmond, and psychedelic means mind manifesting.
Okay.
So very broadly speaking, you can think of it this way: is in your brain, different parts of the brain are generally responsible for different things. Your frontal lobe at the front of your head is actually predominantly there for inhibiting stuff. So it's actually like pushing stuff down. It pushes down feelings, emotions, core needs, etc., because it's keeping you functional to focus on what's around you.
Yeah.
What psychedelics do is they switch off the frontal lobe to allow your deeper emotional parts of your brain to spring forward in front of you.
Yeah.
So you almost find that your mind manifests all of your emotions, your needs, etc. And this can be really helpful for people because it helps for deep introspection and self-awareness.
Sure.
Now that's amazing because there are a lot of molecules that can do that. You've got naturally occurring ones like psilocybin, ayahuasca. You've also got synthetic ones like ketamine and MDMA.
Right.
And some of them work on a neurotransmitter system which is called serotonin. And some of them work on different neurotransmitter systems. The psychedelic agent we use here in South Africa is ketamine, because that works on your glutamate system, which is slightly different. And that one we use because it's legal here. Overseas, some of these are legal. So when I've used psilocybin as a therapeutic agent, I've done it in legal geographies overseas. So all of them have different molecules and different ways of working, but they all manifest your mind to you.
Okay.
Now, what's amazing about this is that very often when someone comes in to get treated for like depression or anxiety or something like that, we're often trying to manage a symptom. We're like, let's just make you feel better. But we're not getting to the core of where that's coming from.
Right.
When you give someone a psychedelic, before you give them the psychedelic, they often do a lot of preparation therapy. Okay. So we'll spend anywhere between 1 to 4 sessions developing understandings of things. We'll go...
Is this to sort of manage their reaction after they take the psychedelic?
That's a big part of it. So one part of your prep is to go, cool, I'm going to give you something that's going to put you in a state of consciousness that you've never experienced before.
Yeah.
You need to know what it's going to be like, and you need to know how you can manage yourself, right? So you teach them all of these skills to make sure that it's going to be safe and okay. So kind of like we were saying earlier with anxiety, I'm going to give you a framework so that when this happens, you can handle this.
Sure.
And another part of it is that you often use the therapy to start directing one's mind. So I'll often ask people to write about their life stories, to answer questions about themselves. You're almost priming emotional information for processing. And very often you ask them to set intentions. What do you want to get out of this? It might be, I want to understand where my depression comes from. I want to forgive my brother, or whatever it might be, right? You just come up with ideas. And what's really remarkable is that when you implant these intentions, people's minds will find a way to direct to those things. And instead of just treating symptoms, you go to the core. Where did this all come from? Where did this all start from? And when you get to the core, people really understand themselves. And now we can start talking about how do we change those things.
Okay.
And when you do it this way, you kind of do this preparation phase. Then you have a psychedelic journey. And then you do therapy afterwards. Okay. And the therapy afterwards is to say, let's take the often very symbolic experience you had, and let's translate that into the understandings you've gained about yourself. And then let's use all of our tools from therapy to teach you how to behave differently so that you can live in a more fulfilling way. So the way I often ask people to think about it is that what psychedelics do differently is they change people's idea of emotions. Sometimes when people get depressed or angry or anxious, they think there's something wrong with them, as we were discussing. And what psychedelics teach you is that your emotions are not symptoms. Your emotions are messengers.
Okay.
And they're messengers telling you that there's some kind of need you have that's not being fully fulfilled. And if you can understand what that message about your need is, and you can learn ways of meeting that need, that painful emotion goes away. And psychedelics help accelerate and catalyze that process to help people do this in a really fast, really profound way. And so the way in which it's different from recreational use is it's directed, it's targeted, and it's couched in a broad therapy. And what's amazing is when we do things like this, your traditional therapies and psychiatric treatments usually yield improvements in about 33 to 46% of people. In psychedelics, and especially at the clinic where I'm one of the directors at Syntonic, you'll see results somewhere between 88 to 89% of the time.
Wow.
So it's really profoundly effective for a lot of people because we're not treating the symptom, we're treating what's underneath. And so when I started to learn about this in the literature, I was intrigued and started to gain experience, knowledge, trained further. And because we were able to do this overseas, we realized, look, not everyone can travel overseas to do this. We need to be able to bring this to South Africa in a way that's accessible to people. And so we founded Syntonic. And it's an interventional psychiatry clinic where we have psychiatrists, psychologists, nurses, interns, and we do a whole range of novel treatments to be able to complement what people already have. And we're seeing amazing, amazing results for people.
That is incredible. And I'm glad, to learn about, before just giving somebody a psychedelic, there's a whole assessment and preparation that goes into it because, as you had started, talking about it and you mentioning how, it brings things, to the forefront, unresolved things, things that in ways that you may have never thought about them. And, before you had mentioned about the prep, I'm thinking, flip, like, would this not just mess somebody up like completely if they just, tripping there and thinking about all of these issues that they have that are unresolved? So I guess now my question has changed in a way to want to know, like, has it ever, backfired where, you've got a plan in place or the patient has done the prep work. Now you've given sort of the treatment or the recommended dosage of psychedelic and then it backfires.
So the great news that I can honestly tell you is not once.
Okay.
Never happened.
Yeah.
And the reason for that is we carefully screen people because, as I'm sure you can imagine, psychedelics are not for everybody. There's a philosopher and neuroscientist named Sam Harris who has a great way of explaining this, where he says there are people who, for them, the tray table of consciousness should say upright and secured at all times.
Sure.
So when we screen someone, we make sure, is this the right thing for you or not? And if it's not the right thing for you, there are a whole bunch of other things we can do. We can do transcranial magnetic stimulation. There's a whole bunch of other treatments we can use. So we carefully screen to make sure you're the right person. And just by doing that, kind of can't backfire.
Yeah.
Because you go in prepared, can't backfire. And because we do it under close medical and psychological supervision, you know going into this that no matter what you get confronted by, no matter what happens, you're not alone in this. We've got your back. We'll be able to do anything. We can chemically modify it. We can psychologically hold you through. And so we've never once had an instance where it's backfired. Where, as you say, the great danger of recreational use is very often you don't have intentions. You don't know what's going to come up in the back of your mind. And you might not be in the best environment. It's very, very easy for that to go well and have fun. Yeah. But it's also really easy, as Sam Harris would say, to end up at the mountain of shame for 1,000 years in that trip. You don't want to be there.
Absolutely. So then what would disqualify somebody from, getting that treatment?
So there are a couple contraindications, as we call them. So if someone has a history of psychosis in themselves or their immediate family, we find psychedelics are not necessarily best for them because it'll make you unravel a little bit too much. We also find that if people are in a manic phase with bipolar, it kind of makes it a lot worse. So we don't usually give it under those circumstances. One of the other big ones that people often have to keep in mind is that if anyone has a history of cardiac disease, so any kind of heart disease or really big issues with blood pressure, we tend either to control that in our medical screening or not allow that person in because psychedelics do change your blood pressure and they can really exacerbate cardiac conditions. So usually when we look at it, we often broadly say psychosis or cardiac issues. There are a few other smaller things, but they usually require more modification. Those would be the big red flags for anyone considering this.
Okay, cool. Wow, man, that is so fascinating. That is really fascinating. And like as you're talking about this, I'm just the way that you are so prepared at this and making sure that it's safe as well. That is widely important because you don't want to get into a situation where, with the responsibility that is on you in assessing somebody, you become complacent or negligent. So you kind of always have to be on your toes and, thinking clearly as well, right?
That's exactly what it is. So sometimes people will, kind of think, sure, all that prep, aren't you being a bit of a stickler, etc. And I often try to remind people that if I care about you, I don't want to play dice with your mind. Sure. It's very easy to do that with my own. Like I want to be responsible to you. So I often say to people, the treatment approach we use at Syntonic and the way we think about the level of care we want to give is like, we will literally imagine if this is a member of our own family, would we do this? Would we be comfortable with this? Yeah. So that they know that this is about looking after them. And when you do it that way, I think it really shines through and it's a big part of why people get a lot better.
Awesome. So there are a couple of other new forms of therapy that I learned about, in prepping to this interview. And maybe they aren't that new, I don't know, but it was the first time that I came across it. One of them was IV therapy. And the other one was something with a big name that I've even forgotten, but like, what was the other one?
Transcranial magnetic stimulation.
Yes, that is the one. Okay. So what is that? And then also, what is the IV therapy?
I'll start with the IV therapy, and don't worry, you're not alone. It took me about 25 times to just get transcranial magnetic stimulation right. The good thing we can use, now that we've explained what it is, we can use TMS instead.
Okay, cool. I knew it was something with trance, but I don't want to use the wrong trance and get into trouble.
That's wise, man. So if I go with the simpler one of IV therapy, so we call it IV therapy for public forums because you don't want to use certain medication names. There's like regulations around it. But I was saying to you, you get lots of different psychedelics. Mm-hmm. So in South Africa, a legal psychedelic is ketamine. And so ketamine can be ingested in one of three ways for therapeutic purposes. There's like an intranasal formulation, but it's really expensive for people.
Okay.
You can just inject it like a normal injection, or you can do an IV infusion, a drip. So the reason a lot of people prefer the drip method is because when you inject someone with ketamine just in a syringe, it's a Hotel California situation. Once that injection's in, you can check out, but you can't leave. So that can be kind of scary for people. The cool thing with an infusion is because it's progressively dripping into your system, if for whatever reason you were not having a good time and this was terrible and scary, we can just stop it.
Sure.
And it'll be over and you'll be fine. So I usually find that people feel a lot more comfortable knowing this is a roller coaster I can just get off if I feel like it. Again, fortunately, never had to do it, but it's nice for people to know. So IV therapy is just us using that agent in an infusion to kind of do it in a really progressive, controlled way.
Yeah.
When it comes to something like TMS, it is brand new. So you're not alone about that. Like, people have just started to really write about this. And it's an incredible, incredible invention. Many people contend that it's the future of psychiatry. You know, we've been so restricted to medications. They're like, this is a new way. So in like a really straightforward way, transcranial means that it goes through your skull into your brain without having to penetrate your head. Magnetic is it's using magnetic waves to change functioning, and stimulation means we're going to use a current to create magnetic field changes that will affect your brain.
Yeah.
Now, you can do this in one of two ways. You can use those currents to push up activity in areas of the brain, or you can use those currents to push down activity in the brain. So sometimes when we're, for instance, like in a really bad distressed way, your brain is almost overactive. If you use TMS, you can actually tone down those areas. And if you're really, really depressed or something like that, there's too little activity going on in your brain, we can push these currents to actually force activity up. And so we didn't have to give you a medicine. We didn't have to inject you with anything. We could actually just put this thing around your head. And for a little while on regular treatments, push up the activity in these areas. And very often, not only does it do the same thing as the medicines would do, but it outperforms it. You'll see people's chronic pain diminishes quite a lot. You'll see people's anxiety levels go down, their mood goes up. So using this thing is like more of a time-limited intervention. You sometimes do it daily for a little while, or lots of treatments in one a day, or you do it for a couple of weeks. And it seems to create massive changes in the brain by changing electromagnetic activity instead of chemical activity.
And then are those changes permanent thereafter?
So as it works with psychedelics, the way I often think about it is both psychedelics and TMS. If you think about your brain like a block of clay, it's normally like a hard block of clay. And what you do in therapy is you and your therapist sit together and you work really hard to sculpt this block of clay to take the shape you want. But that can be really long and laborious. TMS and psychedelics heat up the clay of the mind. They make it very, very malleable. And so now when you're doing all of this, it just sinks in so much faster.
Yeah.
So when you ask, is it permanent? It's permanent if you learn the behavior changes needed to sustain it.
Yeah.
And so you can kind of think of it as sometimes if you just do these things, could stick, could not. But if you do these things paired with the right therapy to target those areas, absolutely you can permanentize it.
Okay, that makes sense. So when it comes to, because I mean, I think you also train other mental health professionals and, you know, oversee that process or supervise it. What does a day in the life look like for you when doing that? And what are some of the things that you need to observe when you then qualify somebody to be able to practice?
So I do that in one of two ways.
Okay.
So I teach at the University of Pretoria. I used to teach undergrads, but now I get the master's students.
Okay.
And so there it's a very structured, rigorous process. You know, I'll see them weekly for certain classes, teach them in certain things. They have to do certain write-ups, etc. So there it's a very academic process, which is really easy to regulate.
Yeah.
I also supervise psychologists who've already qualified but need to keep learning, because one of the things you learn very quickly about things like psychology and medicine is, you know, the reason we call them practices is because it's a field where you can't be good at this from day one. You can't know everything at day one. You have to practice over time. You're only going to get really good at this after years and years and years, decades. So what you do as a supervisor very often is they'll come in and they'll bring you problems that they're struggling with. It's like, hey, I don't know how to do this, or I'm struggling with this client. What can I do here? And what you bring to bear, having known them for a little while and built a relationship, is you can help them in one or two ways. You can often help them learn new techniques they haven't been exposed to. You can introduce them to new literature they haven't seen before so that you can up their knowledge base. Or sometimes what's really valuable about our career is that because we are the instrument, because we're the human being, you're often helping them work through something that they might have a bias about or an unconscious process about or a thing they didn't think about. And you're just helping them catch that so that they can shift their mindset in a way that opens up new avenues with the person they're dealing with.
Okay.
And so very often that's the kind of work you do. And when you're able to do that, you're able to see that someone's very, very capable of doing this work.
Okay, awesome. And then like on a slightly different note, right? But still under the category of training, you still practice jiu-jitsu. Do you train that as well? Or you just sort of on the, you yourself are a trainee?
So I'm very much both
okay.
Still at this point. So yeah, I have very fortunately become a coach at the academy where I also train.
Okay.
But I think with something like jiu-jitsu, you can never stop being a student of it.
You're always learning.
Always.
Jeez, man, how are you doing all of these things, right? While still, being married, and still having a little baby puppy dog. Like, how do you, balance and divide your attention to everything to make sure that, the ship stays afloat in all areas of your life?
It's a great question. So one I get most, and very often I haven't thought about it. And so there are a couple answers to this. Probably the most important one is that if anyone asks me, how do you manage everything? How do you find time for everything? Mostly it's because my wife is a superstar. Right. That's the hardcore reality. Okay. She's much smarter than me. She's way more capable than I am. And she is honestly the most supportive person I could ever met. So she helps me more than anyone realizes. And so I always want to give credit to her because she'll support, she'll help, she'll refine. But she's also a great motivation because her and this little puppy of ours, Albus, are my absolute everything. Albus. And I'm sure you'll appreciate when you've got a good reason to do things, you get very motivated very quickly, man.
Yeah.
When it comes to finding time, the cool thing is that my biggest strength is that I happen to be doing stuff that I genuinely love.
Right.
And I would do this stuff for free. So It's really easy to do that. What is nice is that if I structure things carefully, you come to recognize not everything needs you all at once. So there'll be times when I'll be very neuro-oriented. There'll be times when I'm doing this. There'll be times when I'm doing that. And so it sounds really cool when you put it all together, but you're not having to do all of it all the time, which is kind of cool.
Yeah.
What I do find is that what does bring balance to me very much so are things like yoga and jiu-jitsu. Very often people wonder, they're like, why do you do yoga? And I'm like, well, for me, yoga is less of a workout and it's more of a meditation. It's a wonderful way of connecting with yourself. And the value that's brought in my life is that someone once put it this way, is that if you think of yourself as a smartphone, right? Like if you have a smartphone and I say, hey, what apps do you have on this thing? And you say to me, I've only got 2 apps. Like, it's not really a smartphone, is it? Right?
Yeah.
We often treat our bodies that way. So you sit there and you don't sit and explore all the different apps. You don't look at all the different tools that are at your disposal. Right. And what yoga is yoga is teaching you to see that your body and your mind are capable of way more things that you realize. It's teaching you to open up new apps, explore new variations.
Yeah.
And I think when you do that, you get a curiosity and a centeredness that you don't otherwise get to enjoy.
Sure.
Jiu-jitsu, on the other hand, is a very funny one because it's probably the most fun I have doing any physical activity, but jiu-jitsu is an amazing analog for life. There's 2 things about jiu-jitsu that you always have to hold. Number one, jiu-jitsu is not an area of life where you can BS your way through anything. You can't say I'm a black belt at jiu-jitsu. It's very easy to find out if you are or you're not, right? You're going to have to put your money where your mouth is. So what's great about it is that you're going to have to prove everything and earn everything. But where jiu-jitsu really shines is you learn how to solve problems under pressure. And if you can master that skill on the mats, you can master it in life.
True, hey? Life lessons. Yeah, with any form of martial arts, I believe.
I think so.
Yeah. As we wrap up, right? And I'm a little bit hesitant. I don't know. I'm daring myself to do this. Okay? At the risk of exposing my own insecurities, I believe, and reasons for why I might have been nervous at the start of this. Do you possess the ability to analyze somebody at, first impressions, like certain behavioral patterns, things that they're doing, that gives you a sense of, okay, this person right now is thinking this or feeling this, or I wonder what's the cause for that?
So the scary answer that I'm going to give you is that it's more than that.
Okay.
I can read your mind.
I'm just
kidding. I'm just kidding. That is just teasing. No, I definitely can't read your mind. It comes from a really funny joke that someone once told me where they said, "You're a psychologist." I was like, yeah. And they're like, "I don't trust psychologists." I was like, "Why not?" And they're like, "Psychologists are just people who weren't smart enough to become psychics."
Sure.
So like, okay, fine.
Wow.
So I definitely can't read your mind, but what I can tell you is that psychologists definitely are trained to pick up, of course, on people's emotions, behavioral takes, all of those things. But the good news is that we only use our powers for good. Okay, so most of us are not paying such close attention when we're not in the therapy room. We kind of turn that button off a lot of the time.
Okay.
But I think like with any profession, you kind of can't help but notice certain things.
Sure.
But I can tell you have a clean bill of health. You were completely appropriate. You seem totally sane to me. So you got nothing to worry about, man.
That was going to be my next question. Like, if you could have done a quick assessment based on the conversation, based on how, things unraveled and unfolded, like, what would that assessment be? What would the diagnosis be?
No, so the great news is that would never be a diagnosis. So
okay.
When you observe people, you can observe a little bit about them, but you need a lot of time with someone to go, hey, I know your personality, right?
Right.
But a lot of what we do isn't just observation. It's observation paired with history.
Okay.
When you've got those two things, then you can give someone a very comprehensive analysis of themselves. But the good news is never be fooled by the movies where we're not that good that we can just know everything like that. I've only had that once or twice with people when something's very glaring and this person found it very funny. I just met them and we were talking a little bit and she was looking for her glasses and she's like, no, it's a third pair of glasses I've lost this week, and the way she was moving, etc. Right. And I was kidding and I turned to her and I was like, how long have you had high functioning ADHD? And she was like, how did you know that?
Oh,
and I was like, okay, I got you, my bad.
So you are psychic.
If only, I wish. I wish.
Yeah. So it seems like, there's much to be excited about for the future of psychology, not just in South Africa, I guess, globally. How do you feel we are tracking, on a global scale? If you compare what's happening here, to other parts of the world, are we on track? Are we keeping up? Do we still have some ways to go? In general, what does the future of psychology look like for South Africa?
It's probably the best question that all of us should be thinking about, man. So it's a very wise thing for us to consider, right? And what I'd say to you is one thing that I think everyone should know is that when it comes to our healthcare providers, whether they be social workers, psychologists, doctors, etc., having spent time overseas teaching and learning there and consulting there, we can all feel very assured. Our professionals are amongst the best on this planet. Like, we are very, very fortunate that we have unbelievably skilled professionals helping our population. We are a really high caliber of people. So in the sense of training, we're world class. Like, we're really, really great. And I think that's a wonderful thing for our country. I think when we look at the future of what we're doing, there's probably two big trends that really matter. So number one, we are trying more and more to move from individual-based treatments to group-based treatments. Okay. Because the only way we're going to make sure everybody can access this stuff is by becoming more communal, which is kind of appropriate for our context. That's exactly the way healing should be done if we can. And again, one of the nice things about things like psychedelics is they're going to be able to help us do that, because those are actually, psychedelics work well for individuals. They work even better for groups. And that's really exciting to see. But that's across the board, that we want to move to a more collective way of doing treatment. Sure. The second thing that I think is big is that we are trying to restructure things naturally to make it accessible to more people. Not just in our country, but around the world. Healthcare is not accessible to people. Yeah. And I think a lot of people are working really hard to figure out clever, inventive, and effective ways of making sure that it's not few people who get these services, that we can find a way of effectively giving them to a lot of people and make sure that the majority of our population can access them. Okay. So the future is going to be more around these exciting, innovative treatments that we've discussed today. The future is going to be more group-oriented, and I think the future is very much about taking what we know works, but making it accessible to everybody.
Wow. That is incredible. And it sounds like exciting times ahead, right?
Absolutely.
So, Anthony, as we wrap up now, how about we do some plugs, right? So if people want to find you and, inquire about your services, come and see you, where can they find you? How can they find you?
So anyone who wants to get in touch with me is very welcome to visit my website. It's www.anthonytownsend.co.za. They will find me on most social media platforms under my name. And if they're interested in the very particular kind of work we do at Syntonic, they can find us at syntonic.me or syntonic.me. And you'll be able to reach out and get in touch with me or the rest of my team for anything you need.
Amazing, amazing. And on that note, you can find us right here, right, on the EXC Studios YouTube channel. This is the EXC-i8 podcast. Our guest in studio today, the incredible, the wise, the well-researched Dr. Anthony Townsend. It has been an absolute pleasure, man. It is so fascinating to learn that you literally, everything that you cover, from neuropsychology, right, to jiu-jitsu and yoga, in your spare time, and also being a husband and the father of a proud, cute doggy, Albus. Oh, man, I'm still, struggling to understand where all this time comes from and how you manage it. But it's been an absolute pleasure having you here, and I'm so glad that you could fit in the time to come and see us.
Likewise, Terence. Thank you for having me. I've enjoyed every moment.
Awesome, awesome. Well, there you have it, ladies and gents, from Mzansi to the world. We hope that you truly enjoyed this journey with us as we delved in to Dr. Anthony Townsend's life and his career, right? And you know where to find us, so keep on coming back. Stay plugged in with us as we ignite your light and keep it burning bright. Keep coming back for more with us on EXC-i8. There we go.
Awesome.
Thank you, my brother.
Oh, thank you, brother. That was awesome.